Hi, this is our quick 5-minute overview of cardiac head-to-toe assessment. This sheet here should be a review of things you learned in your health assessment class, things that might stick out to you that you may not have really paid a lot of close attention to in health assessment are this jugular vein distension. You might want to review your cardiac assessment, where to find that point of maximal intensity, and that 8-to-man mnemonic for listening to the specific valves in the heart. The abdomen, we've mentioned with some of our case studies, the importance of looking for fluid accumulation in the abdomen. That's called ascites. If you have a pulsating mass, that would be a sign of an abdominal aortic aneurysm. And these other areas, I think we've mentioned pretty good. I like that they've got sacrum on here because a lot of times when we're talking about peripheral edema, we think lower extremities. And you need to be mindful of if they are in the bed or immobile, that you need to look to the most dependent location for that edema. And the nails, we'll see clubbing sometimes with low O2 sat, and I just wanted to point that out because when we move into respiratory, you will hear us speak about that as well. And so let's move on and look at some resources in the text that I didn't assign as required reading because most of it you would have had in health assessment, and I knew some of the assessment techniques would be included in the chapters that we did assign, but if you're having problems with confusion on some of the labs and diagnostics, I wanted to show you some resources that are available for you. Okay, so you should be seeing the ebook now. I have pulled up chapter 30, and table 30 has a good description of how to assess for chest pain, and you'll see some of the different descriptors and location depending on whether it's angina or pain with an MI, pericarditis, some of those issues that we've been discussing. And it also does a good job of talking about sometimes gastric pain can mimic angina or MI pain as well as anxiety. So I thought that was a great table to kind of look at. And then as you go on down, there is a good kind of information and a picture on pitting edema, the different types of anchiobrachial index is mentioned in your text as a diagnostic when we talk about peripheral arterial disease. Paradoxical blood pressure is mentioned as well. And so those were some new concepts that I wanted you to be able to review if needed in greater detail. These are in chapter 30. If you understand them from the readings that were assigned with the chapters, don't feel like you have to go back. And then here is where it talks about like carotid bruits are mentioned here and jugular venous distension. Now, as we go on down, here is that 8-to-man mnemonic and where the landmarks on the chest are to place the stethoscope. And then we've got grading of heart murmurs here. And again, as a new practicing nurse, you will not be expected to grade heart murmurs. But if you see this documented in the record, at least that can give you an idea. You know, a grade 1 is going to be very faint versus a grade 6, which is going to be something that is, very loud and present. Now, this is something that I think most of you are going to want to review, and that is this laboratory profile. So this goes through the whole lipid panel. And so if any of you, I know in one of the case studies, we really quickly went through findings. If you're having some confusion on which part of the lipid panel should be elevated, so we have the HDL, should we want to see that elevated? It's more protective versus the LDL that we want lower, and those triglycerides. It also goes in to C-reactive protein, or CRP, that you will see with some of our cardiac patients when they have myocardium damage or inflammation. So you'll see CRP, and then we've got our troponins that we have talked about. So I thought that was a really good table that puts most of what we have been talking about. Now the PTT, those coagulation studies, is not in this table, but remember, if we are putting our patients on anticoagulants, that's important as well. And then here are some other markers that you will sometimes see. Now this, I did get an email from a student wanting more clarification on like cardiac catheterization, echocardiogram, and angiogram. So if you want really step-by-step instructions on what this procedure is, and cardiac cath is a very important procedure, because when there is chest pain, that's one of the if it's stable, it's something that if a patient doesn't like pass a stress test, we'll do a cardiac cath to see, is there any abnormalities like blockages inside the heart that we need to be aware of. Often during those cath procedures, they can actually even fix, like if there's a blockage, they can put stents in. So you'll see here, it talks about all the indications, you know, some are complications after a cardiac cath, and then it will talk about what to do pre-procedure and post-procedure. So this is something that I would recommend that you guys review if you're not familiar with catheterization, because it is frequently done. Years ago, you know, in the instance of an MI with a blockage, it was open heart surgery, a very, you know, invasive, long recovery. But now with the, you know, innovations in stents and different types of procedures that can be done as treatment, we're seeing more and more cardiac caths done to help diagnose and actually provide that intervention to, you know, to treat the problem. So cardiac caths are important to know. You guys all should know the ECG, 12-lead EKG. We've talked about that pretty frequently. It comes up. Here is stress test, and then it even goes on to show like what it looks like when a cardiac stress test is done on a treadmill. And then it goes into echocardiogram, which is like ultrasound for the echo, and that's where they can look at valves. And this is where we mentioned in one of our case studies, ejection fraction. So they can actually get measurements on the function of the heart, and looking at cardiac output and some of those from echocardiogram. And so that ejection fraction is something that you will see. And then it goes on, you know, into some of the other diagnostics. So you'll see here, it mentions this with echocardiogram in the reading that you will see information on ejection fraction here. I found this image here from Penn Medicine that really does a good job of showing what do the numbers mean. And I think that's where the confusion sometimes comes from students, is why is that so important? So you'll see here, normal ejection fraction is 55 to 70%. Anything under that shows low functioning and possible heart failure. So hopefully this video, it is, you know, a little longer than 5 minutes, but I hope that it is valuable in helping you learn more about where to find more information on assessments and diagnostics of the cardiac system.